All right, let's go into probing. Everybody has seen this nylon probe, which I think Daryl introduced to our practice many years ago. We actually use this nylon probe, not this exact one, but the yellow one that Hugh Freedy has all the time, almost every day on our trays. And I'd say about 60% of our trays have these probes. They're really easy to see, and you can use them for teeth or implants. So you have a nylon probe. You want to probe at about a 45-degree angle to the teeth, but you remember, you're trying to detect inflammation. There's no true measurement of pocket depth for implants. It's an attached pontic. All you're measuring is how deep the pontic is. So to take probing, I know this goes against everything that we do with teeth, but with probing depth around implants, it's not as important as probing depth around teeth because you realize the attachment is different. All that means is the pontic is seating deeper within the tissue. It may make it harder to clean, but it's not an indication of health, is how deep the pocket is or the measurement around it. So you're really looking for bleediness. You're looking for inflammation signs more than anything else. You got to remember again that there's no direct perpendicular attachment to the implant itself. There's only these things that go around the tooth, these fibers that go around the tooth. It's a pontic attached to the base. If you're going to learn one thing today, when you ask the dentist what you learned, first of all, you learned David Schwab is someone not to miss. And secondarily, that an implant is an attached pontic. 90% of the dentists don't even really know that concept. All right, let's look at the crustal bone level. We talked a little bit about biologic width. This is really a true indication of what's going on with the implant and health. You want that bone to be up to that first thread. Now, I don't know if you can see, this one's a little difficult to see. This is 2 implants in the same patient, and I freely admit this one's mine. If you look, the bone level is dropped down on the distal implant. Now, this one was in for at least 10, 15 years. In fact, I just saw the patient the other day, and he's doing okay, but this is something that you have to watch. If this is progressive, if you see in a year or two it's moving down even another thread, then some action has to be taken. You have to maximize your ability to decrease this inflammation, and if it gets bad enough, to build the bone back up, which is unpredictable around implants. So, look at radiographs. Vertical bite wings are probably the best one to look at them with. If there are any changes, note them. And do the normal remodeling, you just got to look to that first thread in the 2-stage implants. All right, instrumentation. Now, I remember years ago, I did a 3-hour lecture to, I think, a hygiene group at the Sheraton. Some people were there. And I remember after the whole thing, the bottom line is, don't scratch the implant. That was the bottom line after 3 hours of conversation about dental implants and dental maintenance. But it's a lot more than that. But still, don't scratch the implant. That's really the bottom line. Implant is what? It's a soft metal. It's titanium, and it scratches when you use substances that are harder than itself on it. Stainless steel, you can't use your regular instruments on it. Now, occasionally I cheat. If someone had one of those hybrid dentures and has one of those big globs of calculus on the lingual, I take the back of the scaler and just push, and that knocks the chunk of tartar off. You can use it like that. You can use it on the prosthesis when you have a big hybrid, but don't go down deep underneath the tissue where you're touching the implant itself. So I'm not saying you can't use stainless steel when anybody has an implant, but watch where you use it. You can use it on certain instances. But of course, if you can't use your bread and butter stainless steel instruments, calculus is going to be tougher to remove. So we have that circumstance. There's the basic types. You have nylon, graphite. Let's look at nylon first. I'll go through the list one at a time. The nylon is, I just spoke to the Hugh Freedy. It's not, they don't call it nylon anymore. They call it plastique or plastel or something like that. Their own brand, but they have their own implant scaler, which is a Hugh Freedy brand that screws on to the handle. They come in a lot of shapes, you know, your 4R4Ls and a sickle scaler. But in a lot of ways, when you do this, doesn't it feel like you're just playing? It doesn't really feel, you don't get that satisfaction that you get when you're cleaning regular teeth. You can remove calculus to some extent with it, but it's difficult. And you can put it in the ultrasonic and the autoclave in the usual manner. Nylon scalers, they're a little tougher, they have a little more substance to them. There's something else that can be used. You can use the ultrasonic. Again, it's at different shapes. You can't sharpen them. I think the Ufridi ones you can sharpen. You can ask Ronnie outside about that. But the nylon ones, most of them you can't sharpen. Graphite ones are probably a little more common. Do you have the graphite ones in the practice, the black ones? You get the different shapes. They all come in our basic shapes. You can ultrasonic and autoclave it. You have to have a special stone, though, if you really want to sharpen it. You have to have a dedicated stone. Because what happens when you sharpen your regular stainless steel instruments, they get little flecks of the metal in the stone, embedded in the stone. And then if you sharpen your graphite curettes, it picks up some of the metal and becomes more abrasive. So you have to be a little careful what stone that you use, or you separate these instruments out. And again, there might be a little more effective than nylon, but it still don't get that same satisfaction that we all love, you know, when we're cleaning or removing calculus. They do have different versions of Cavitron's tips. This one I think is from Tony Rizzo. I think we used to use this one. Sometimes these tips would explode, though. You ever have that the plastic comes off? But this is basically just a gentler way of using a Cavitron. Cavitron itself has Dentsply. I'll be correct here. Dentsply has their own tip as well, which looks something like that. So these work pretty well. You have to screw the tips on after a period of time. There's a certain instrument to screw on. But if you like to use a Cavitron, which we all do, they do have inserts for dental implants.